Earlier this year, longtime state representative and former city councilor Stephen Hay, who served a long and distinguished career for the city of Fitchburg, announced his retirement. There are two candidates vying to replace him in the Massachusetts State Legislature, representing the city of Fitchburg and Lunenburg Precinct B. Those candidates are Fitchburg City Council President Michael Kuchmarek, the Democrat, and retired Fitchburg Police Lieutenant Glenn Fossa, the Republican. In this debate, for the next hour, these candidates will talk about all of the issues that are going to be facing us in the next 2 years and how they will respond and represent you, the voters, as their next state representative. First question. COVID-19 has triggered a severe state budget crisis, possibly a $5 billion shortfall this year. Revenues are declining and costs are rising. Do we address this crisis through tax increases, spending cuts, or a mix? Please give voters specific taxes you would be willing to raise or specific programs you would be willing to cut in order to make up the shortfall. Mr. Kuchmarek.
Kevin, this is a critical issue, and you're absolutely right. This is a moving target right now. We've heard everything from a $3 to a $6 billion deficit in the current fiscal year that we're in. And I don't believe we can cut our way out of this crisis. And so I believe first we need to look across the board at all operational accounts. I think wherever possible we want to be able to ensure that we keep personnel and critical services infrastructure funding in place. Look at operational accounts, across the board cuts, and the governor has already begun issuing notifications to state departments to look at 25% operational accounts cuts there. And so I believe that too is critical. But again, we're not going to cut our way out of this one. There is also a $3.5 billion rainy day account with the state. And in case you haven't noticed, it's raining outside right now. And so while I'm not proposing that we use all of those funds, we need to use some strategically to ensure that critical infrastructure funding, resources, and personnel remain intact throughout. So we're looking at a combination of cuts and a combination of using existing rainy day funds that we do have to weather this temporary crisis.
Mr. Fossa.
Yeah, so I do have some experience with when we're challenged financially. Obviously, the police department over the years, working here in the city of Fitchburg for well over 30 years, watching fiscal ebbs and flows, we have dealt with budget cuts before. And it's not always easy. And as my opponent has so aptly said, some of it may have to come from cuts, and some of it may have to come from other potential sources, such as the rainy day fund. However, there are innovative ways as well to address shortcomings and shortfalls like this, and we've done that. So considering all things, one of the things that I think will happen, particularly with good representation and experience, is that we address it in a three-part system of innovation towards the budget, cuts that may have to take place, and both Councilor Kuchmarek and I are familiar with sort of the mandates that are put down through personnel contracts where cuts can't simply take place like that. We hope and pray that that won't result in layoffs of significant services, state police, state fire marshal's office, or trickle down to local aid that helps our police, fire, and EMS. And then, of course, those funds that we may have that could be marked to assist as we pull out of the COVID disaster.
I would add that I think it's critical that now is the time for us to look at everything from increasing revenue to those cuts. And with that, I would say that if we want to properly fund infrastructure improvement this year, making sure that we can maintain it this year and in many years ahead, as well as fulfill the promise of the Student Opportunity Act, which pledges an additional $1.5 billion to our public school systems over the next 7 years, I would add that it's likely critical that we have to look at things like the Fair Share Amendment. Initially, this had been proposed as a ballot question. This will soon come before the state legislature to decide whether or not to act in favor of this. And what it would do is add an extra 4 cents tax on every dollar earned by individuals over $1 million. And I believe that this would create more than $2 billion in revenue on an annual basis, which would allow us to properly fund our public school systems in the future and actually address critical infrastructure. This is something that infrastructure is a bipartisan issue. It's something that we hear talked about often. And as a city councilor, I've heard frequently that roads are the biggest issue in our city. And if that's true, we need to fund it like the biggest issue. And that means creating new revenue sources at the state level. And keep in mind, while I don't relish adding new revenue streams or taxes anywhere, there are only 7 individuals in this district who would be personally affected. And for too long, the millionaires and billionaires of Boston have dictated how and where funds are directed throughout the state. This is an opportunity to ensure that those dollars get to work for you, the residents of North Central Massachusetts.
Well, we differ on methodologies, and we do differ on tax and spend. And quite frankly, the conception of taxing individuals here in the Commonwealth and even the country leaves out a simple matter that we currently enjoy here in the country, and that is freedom. And the freedom for an individual to say, I don't want to be taxed anymore at 4%, and I am in that top group that can simply move if he feels like it or she feels like it. We have to be very careful about how we communicate to our larger earners in the Commonwealth and even nationally. So tax and spend is not a methodology. It is a last resort, in my opinion. And when you really examine it, there aren't really enough rich people, even in the world, to fund all of the things that we'd love to see government do. So I'm a small government, small tax, and find innovative ways and creative solutions through the business practice of government to make it affordable. The notion that we will tax someone at any rate and simply close the loophole or close the imbalance of the budget, we've already seen fail a number of times in the most liberal of states. And I intend to bring a much conservative view towards funding streams, towards how we manage our money, and doing it better. And simply put, that's the platform from which we stand.
Massachusetts taxes the wealthiest, the least out of the states of New York, Connecticut, Rhode Island, and even Vermont. So this would be keeping us in line with the states around us. And keep in mind, again, if we want massive infrastructure repair, not just in the city of Fitchburg, but across the entire Commonwealth, which we both have to acknowledge is crumbling infrastructure across the entire Commonwealth. And the dysfunction at the federal level isn't coming to our aid to infuse new dollars for an infrastructure bill. So we need to take that into our own hands at a state level, address that critical infrastructure. But again, we have been defunding and underfunding our public school systems for decades. And if we're going to meet up for those deficiencies and those gaps in improvement and learning outcomes, we need to ensure that we're properly funding our public school system. We're talking about $1.5 billion increase over the next 7 years, equally dispersed. We can't fund that, and we just passed that bill a single year ago. We need to ensure that the funding's available to live up to the promise of the Student Opportunity Act and then continue to exceed it, because I don't believe that we can spend enough on our public school systems. And until the potholes are gone and our bridges are in grade A condition, I believe that we need to create revenue sources that properly address these issues.
My opponent said that we have very few people that would be affected by a 4% increase in taxes. And that, to me, is actually a call to attract more millionaires to the area, more people with money to spend, and more people who can afford to invest here in the city. We just take a look around and we can tell that we could use just a few more folks with some disposable income coming to our retail establishments, spending time in our local businesses, and building out the investment that's available here. One of the things that we have in central Massachusetts, and Fitchburg particularly, is we have a commodity that no one can buy across the globe, and that's water. And rather than sell off our water, which thank God our leaders are smart enough not to do, one of the things that we can do is ensure that folks have resources if they build a home for decades to come. With some of the things that I'm sure that we do agree on, saving those resources and working towards that end can only make Fitchburg a more attractive place, and then we can afford all of the things that we'd like to see our local government do. As state representative, I'll bring these issues forward and look at the funds that are available currently. We talked about infrastructure in a call with the governor. It is clear that there's about $100 million available that's being in committee right now. It's sitting in committee for numbered roads. That's Route 12, it's Route 2, it's Route 13 and 31. All major roads that we travel every single day here in Fitchburg. We sure could use that money.
You both talked about taxes and infrastructure. Major infrastructure bill before the state would call for 2 taxes to be raised, gas tax to be raised, and a tax on real estate transactions. Are either of you willing to consider a increase in the gas tax and or additional tax on real estate transactions in order to fund added infrastructure monies to the budget?
Well, my response is going to be very similar again. Any new tax, particularly for our challenged demographic and our challenged population right here in Fitchburg, is abhorrent to me. So that in the event that that is the only way out, I think that we're only going to dig ourselves further and further into this abyss that we're currently in. And when we talk about fiscal responsibility, local aid, earmarks, we have to really look at why Fitchburg is not always necessarily getting their fair share, and that's my approach.
I would argue no to both. I would propose that the Fair Share Amendment be the priority means by which we increase revenue to the state for infrastructure, and that annual allocation of an extra $2 billion should provide enough funding for us to begin to strategically and systemically improve and increase funding for both infrastructure and education alike.
Bar owners across the state are questioning how much longer they can hold on to their businesses under the state's COVID-19 orders, which will only allow bars and nightclubs to reopen at Phase 4, which only takes effect when a vaccine becomes available. Do you support or oppose Governor Baker's order, Mr. Fossa?
Well, there's always a need to be safe. Coming from the public safety sector, I understand regulation and I understand keeping people safe. I wouldn't necessarily blame the governor per se. He too, like any good government official, works in a collaborative effort with those that have represented their communities and had input. The medical community has given their input and the governor has come out with his position. However, I think that there's a lot of small business people that are very confused. You can go into a big box store and stand right next to someone while you select your retail piece and the other person looks over the product in a very close proximity, and be it masked or unmasked. But then if you wanted to go to a social environment with the same distance, not for a prolonged period of time of any kind of intimacy, and that the communication from the regulation is confusing at best. I just recently got a haircut for this appearance tonight, and I learned really well that some of those regulations about barbers and salons are being lifted soon, as long as there isn't a big spike in COVID. However, they have sort of had to travel through a regulation that's really incongruous with a lot of the other industries that have been affected by COVID and not as heavily regulated. So there's a lot of confusion. If anything has happened, government has not communicated well the reasons behind the impact to small business, and in some cases, those who have lost their businesses.
Mr. Kuchberg, bars and the taverns.
So I truly believe that it is indeed the governor's responsibility to set the parameters of how we open, and I believe it's the legislature, how, when, and if both bars and other establishments open, because bars are not the only ones that are stuck in these situations, unable to reopen. And so I believe it's incumbent upon the legislature to ensure that within the framework that the governor has laid out, that the resources and information are both available, as well as backstop funding for those organizations and institutions that cannot reopen. So, you know, over this past summer, I've embarked on a 110 small business tour across our district, across Fitchburg and Lunenburg, and businesses are out there are suffering. And there's some businesses that have yet to reopen since March. Others that are just now starting to reopen, and others who are finding ways to be entrepreneurial and innovative. But I think, you know, to some of our local examples of the Boulder Cafe and Curious Escape Rooms, both on Main Street in Fitchburg, they've been unable to open. They haven't been given the guidance that they need from the state to be able to move forward. And I think of an organization like the 50/50 Diner that just recently reopened in midsummer and is struggling. They're trying to find their way and their pathway back to profitability. And in both of those cases, we need to ensure as legislators, one, at the base and the heart of everything we do is constituent services. I've done that for the past 7 years as a Fitchburg City Councilor, and it's ensuring that the organizations and the businesses impacted have the information that they need, as well as the resources and funding if they're told they can't reopen. There's also businesses, however, like the Proctor family in Lunenburg, who have found ways to be innovative and finding new markets and finding ways to be profitable and successful. We need them to be successful. We need jobs to remain, and we need wealth to continue to be generated in the Commonwealth. So that's crucial. At the same time, however, I've met with the nurses from the COVID unit at Leominster Hospital, and they tell the stories of tragedy and of really horror of the loss that we're feeling in our community and the toll that it takes on our essential workers as well as on families. So I think the key word here is balance. There's no one action we can take today that will both save lives and reopen our society. It's a careful balance, and it's monitoring health conditions on the ground, and government should be at its best when it's coordinating between community, constituents, in the executive branch and the local municipalities.
I've been around small business since I was 5 years old, and that gives me 55 years of watching the ebbs and flows of business, the successes and the failures. And whether I go back to the 60s when businesses were responsive to their customers and customers were loyal to their businesses, government didn't always play a major role. And business people, at least the ones that I know, are a proud group. They're proud of their own success. They're proud of the business they grew, the business that they built. And they are reluctant both to take a handout from a government program, and they're reluctant to have the government have in any way a handle or a hand in their business from day to day. I remember in the crash of 2008, I had to let 2 employees, and I only had 2 employees at the time, go because of the change in the fiscal climate here in the Commonwealth. And contrary to sometimes what we believe or think about business folks, they really care very much about their employees. And we were fortunate to know that those employees would be able to get other employment. One, a Fitchburg State alum, Michael, right about the time you were there, and he moved on to another job. But it hurts when you're in business and it takes a hit. It hurts to reinvent your business model and change your direction. And fortunately, we were able to do that with innovative ways. And the fact that I had something to rely on, which was my day job. However, once again, we are at that juncture, we are at that stage where we stand for less government, more freedom, and the freedom for those businesses to act on their own. However, one of the things that did happen here tonight is we talked about the regulation that was put forth by the state. And from some of the small business people I speak to and spoke to, they didn't have a whole lot of input to be able to be heard on how it would impact them and how they could probably come up with a more innovative solution to closing.
The guidelines that are being set forth in the plans are from the governor's task force, unelected task force. We're more than 6 months into this now. Should these decisions, should these plans, should these guidelines and timelines continue to be formulated and enacted by a non-elected task force, or should the legislature be standing up and taking on more of this decision making? Are you okay with letting the so-called experts as determined by the governor handle this, or would you as a state legislator demand more say into reopening plans?
So I would argue that, you know, the governor's panel and task force is a good first start, but the reality is, and I think we're seeing it, and my opponent just talked about, there's onerous requirements and there's not clear rationale or consistency in how it's applied in all cases. That's frustrating. I mean, Fitchburg has right now a 15% or more unemployment rate locally. That's devastating, not only to the families and our workforce and our economy and the small business owners, but that's also devastating to the region as well. We need to get people back to work, and there needs to be clear, decisive guidelines on how we do that. Great Wolf Lodge, for example, you have other large venues that are opening in some way, shape, or form, but Great Wolf Lodge has, hundreds of employees that are unable to go back to work. And so, I met with Mayor DiNatale a couple of weeks ago to talk about exactly that, of how do we provide better guidance. And in reality, I think what we can do as state legislators, and I think what we as municipal leaders also need to do, is ensure that the governor's task force is representative of all of those examples around the table. Of if there's someone that doesn't fit neatly into one of those 10 different boxes of commercial or restaurant or bar, we need to be able to help fast track that information so they can make real-time decisions about things that impact not only their profit margins, but their employees and public health conditions as well. But I also believe that, we talk about less government, but at the end of the day, one of the purest forms of government is ensuring the health and safety of the people that it swears to protect. And, public health is one of those areas. And so we need those careful guidelines, but I think we can do a much better job. And I hope that the state legislature and the governor can work together better to better convey that information to the business owners that are impacted.
So my take on that is to expedite, and government moves slow. I worked in government most of my career, thankfully, in an organization and a discipline where time's not on your side. Things have to change, and they have to change quickly sometimes because someone's life may be in danger if it doesn't. So my concept and my innovation ideal would be to increase the task force to include some heavy hitters who have a proven track record of changing things quickly for the better. They're out there. We need to solicit them, and we need to embrace them and get them to the table quickly. And we need to do that in government. We can't sit for months at a time, bills in committee, not releasing funds, not making the changes necessary, and getting things done for the people. This is what I hear every day when I speak to people, constituents out on the road. Why does it take so long to get something done? We can change that, and I believe we can.
Our next question is pretty much along those lines that both of you touched on. In less than 6 months, Massachusetts went from having one of the lowest unemployment rates in the country to now having the 5th highest unemployment rate in the country. When it comes to getting people back to work, does the government need to get involved or get out of the way? What is your philosophy when it comes to tackling joblessness, Mr. Kushmerek?
Yet again, it's a combination of the two. I think I experienced that in the small business tour that I did of the 110 businesses. In some cases, it was, we need more resources, we need more help, and we need more assistance along the way. And other times, it's businesses that are doing well, and we need to know when to get out of the way and allow them to succeed on their own merits. And so I think it's that careful balancing act between the two. But I'd also argue that it's short-sightedness that got us to where we are today. We're in a crisis right now that we are unprepared for as a Commonwealth. And there's enough blame to go around. It's not just with the legislature and the executive, it's at every level of we're unprepared for where we are today, and we should have been doing a better job. And so I would say that we can't just think short-sightedly about how do we get people back to work tomorrow, because there could be other waves. We could or may not have a vaccine in the near future, and I think we need to be realistic about what lies on our immediate horizon, but we also need to look long-term of when we come out of this, how do we come out of this more resilient with the resources that we need to succeed and to thrive? That's more investment in infrastructure, that's more investment in public education and public higher education, and ensuring that our trade schools are ready to go so that when high school graduates walk out the door, they have a clear pathway to making money, to being successful, and to starting families. That's immediate investments in our trade schools and higher education when we get out of this. But then again, it's also ensuring that we're prepared for this next crisis, whatever that may be, whether it's, again, biological, environmental, or economic. We need to be more resilient as an economy. We need to be more resilient as a Commonwealth, and we need to do better preparedness so that never again do the workers, businesses, and families have to suffer like this in Massachusetts.
I'm really happy that this is the question, Kevin, and I'm really happy to say that in October of 2001, I was appointed as the police liaison to the Joint Terrorism Task Force to develop the police response to any upcoming crisis or emergency that would hit the city. I worked very closely with a deputy chief from Fitchburg Fire Department, now retired Michael Spano, and we developed the Community Emergency Response Plan. And part of that plan was PPE, which we've all heard about now. And in 2001, most civilians, if you said PPE, it would probably sound like a trip to the bathroom. But today, everybody knows exactly what it is. So it's personal protective equipment. And proud to have been part of not only equipping in the physical sense, but writing the manual that how the city would roll out in the case of a chemical, biological, radiological, nuclear, or chemical threat. That kind of experience lends itself to being prepared. And it's what government does when you're not looking, with those funds, with those pieces of equipment, with the need to maintain those resources. And when no one's looking, they're doing something else, either with the money, or they're doing something else with the resource, or they end the office and make it a part-time position. And I won't speak to the national readiness, but we do know that Fitchburg was very well prepared in this last crisis. Proud to be part of it, proud to know that Fitchburg does things very well, and proud to know that they still hold it in high priority to be ready for safety issues that come to the population. So in terms of being prepared, shame on whoever's not prepared as a community, because they were given all of the guidelines, they were given all of the maintenance requirements to be sure that they were ready to take care of their populations. And while we're on that subject, a government should never make their population fearful. They should make them feel that someone's in charge, someone's in control, and there is truly a plan. Proud to have been part of that plan that they actually use still today since 2001. So that's my response to being responsive.
And I know that's where that answer went, but the question, I don't know if you want to address that real quickly, is when it comes to unemployment and the joblessness and us being the 5th highest in the country now, do you believe that government should get involved or get out of the way?
I think you need to make it attractive to be employed and maybe bring employees from other communities to add to the employment possibilities. The fact that we have unemployment may be because we haven't done a really great job of embracing the plan. And if we weren't prepared and we didn't do our job as government officials to keep businesses afloat, even with the incentive money that was released to keep small businesses. I have 2 friends that actually benefited from that. To address it, once again, we need to act quickly. And we probably need to bring in experts from the business community to tell government how to do it.
I would argue that, I also agree that Fitchburg responded well with the resources and availability of funding that it had from both the state and the federal government. But I think if we look at this and say this is a shining success story as a Commonwealth of how we've handled this, we've really missed the mark. And I'm proud to have worked with Mayor DiNatale and my colleagues on the City Council to ensure that we get the CARE dollars out to the organizations that needed it immediately, creating those stopgaps for a wide array of businesses that were forced to close initially and then reopen, ensuring that they have the PPE and the resources and the information at a local level to continue to make those crucial decisions about how best to reopen and how to do so safely and with the least impact on public health. And so I applaud Mayor DiNatale and his efforts. He acted swift, he acted decisively, but at the end of the day, I mean, we're yet again, our transmission rates are continuing to go up. We haven't had clear guidance from the governor about how best to react as we move into green, yellow, and red categories. And so there's a lot of work to do. And so I think we need to get more involved, and I think at every level. And I think it's really incumbent upon the state to better engage municipalities and take leadership from the leaders that we have, even locally.
I think it's important, too, that we don't incentivize conditions that are so impactful to our populations. There are obvious statements afoot that healthcare professionals and organizations were actually incentivizing overdiagnosis, over reporting of COVID cases. If that's the case, that's something that should be very closely looked at, and probably an activity for another day while we respond to the crisis. However, it's very important that government is much more transparent than they have been, I think, on these issues of taking care of the population. And in that sense, I do think there's promise, and I do think there's hope. Fitchburg is in a unique situation that when you spoke about those who may be unemployed, don't have significant resources, because we need to attract and have more folks come to us and open businesses and be in business and give that opportunity. Opportunity zones are important. Government is important when it comes to that, but it's only something to start the business opening, and not necessarily the panacea or the answer to having commerce right here in our city.
I would argue that, over the past several years, we've had $87 million of public investment earmarked towards improving the Fitchburg downtown. That's everything from a theater block to the B.F. Brown arts community in conjunction with the Fitchburg Art Museum. That in turn is spawning and really attracting private investment. Everything, we'll see 2 new restaurants reopen, high-end market rate condominiums being built right in the former gas and electric building across from the Fay Club. And soon we just saw a 35-year-old make a $1.6 million investment at the doorstep of our downtown, right at the corner of Blossom and Crescent Street, turning a lot that for almost 2 decades had been abandoned and will now become 7 market rate townhouse units. Again, on a formerly derelict lot that had been abandoned and really became the symbol of our previous failings. And so I would argue that I think we've really set the stage recently. Over the past 5 years, I'm proud to have worked with Mayor DiNatale and Representative Hay and others to bring that funding into Fitchburg to spurn some of that growth for the near future. And excited about the investments that are being made today. Those will create jobs, and those will revitalize not only our downtown, but our region.
I would like to address that as a small business person who actually owns a building very close to the corner of Main Street. And I invested in that building in 2005. And it was a decision that I made because I love the city. And it was a decision I made because I want to see something happen here. And for the last 15 years, I've watched the buildings around me be vacant. And I've watched the buildings around me lack any kind of interest at all. And most recently, as my opponent has said, there is sunshine on the horizon. However, that's taken a number of years to come to fruition, and it's been changed a few times. And now that the tax incentives that had to be sold in order to incentivize actually putting the project forward have been realized, albeit within just weeks of its deadline, we will see that growth. And that's what I'm going to bring to the State House. I'm going to bring real-life experience, someone who's done this, and someone who's waiting for the ship to come in for Fitchburg as well. And we're going to work hard to make sure that those buildings get filled. If they don't get filled, they get raised. And if they get raised, that something brand new can come to the city of Fitchburg, because we have water.
This past July, both the House and Senate approved bills to enact sweeping police reforms. However, although the 2 bodies approved slightly different versions of the bills, it has been stuck in conference committee since August and could be hammered out and sent for a final vote when one of you is sitting in that chamber, or an all-new police reform bill. Would you have voted in favor or in opposition to the police reform bill that passed in July, and why? Mr. Fossa.
Absolutely not. Having come from 35 years of law enforcement, having been a commander, having been a trainer, having written policy, having written manuals, and actually developed training programs internationally, My opponent and I actually spoke about visiting the same place where we thought probably we would never visit ever in our lives, but we can get to that someday. The police reform bill included sweeping changes and sweeping ideas that were not well vetted, well thought out, and they certainly did not have good input from the experts in the field that I knew that were asked originally to participate and then were dismissed from participating in the draft of that bill. Further, I went and contacted my state representative and asked very succinctly for him to vote against the bill being passed because it wasn't well thought out, it wasn't well written, and it certainly didn't have the input from enough experts in the field. The fact that we live in Fitchburg, the fact that we live in central Massachusetts and New England, leaves us with sort of the common security and thought that police officers are well-trained and do the right thing all the time and generally are a tremendous asset to our community in the larger sense. School resource officers, elder officers, domestic violence advocates, officers trained in specialties where just 30 years ago we would have not thought it their job to do so. However, the concept that we had to throw the baby out with the bathwater and start over because something happened hundreds and sometimes thousands of miles away from where we are left us with this notion that we had to act and act quickly. And the knee-jerk reaction of this legislation simply did not have the effect, and still is held in committee, thank God, that we would have wanted the result to be. And I would just say this, that very, very easily we can be critical, and very easily we can say that something was amiss or there's inherent faults of the system. But when you look at us locally, and here in Fitchburg, we easily could be the model nationally. As a young rookie, I recruited the very first female police officer to come to the city of Fitchburg and represent us as a police officer and break the gender block that existed at the time. And since that time, if you look at our department, it's so diverse, so full with great people and happy folks that want to do a good job every day with their community. Black, brown, white, you name it, we have it, and it's awesome. And we're blessed. And that can be a model across the nation. This legislation that impacted or could impact the police as a profession was not well written. It was not well authored, and it didn't include all of the aspects that were brought up by the police professionals across the country. Just recently I got the endorsement of the Central Mass Chiefs Association, Chiefs of Police, and Massachusetts Chiefs of Police, as we had these conversations about this legislation and its impact to communities. So it could be drafted better. I won't go into detail, but even one of the mentions of one of the organizations that they wanted to appease, if you dig down and do the investigation, they're funded by an organization who has maybe limited interest in public safety and certainly doesn't have the interest of the American people.
I would be a no vote on either form in the House or the Senate, and I too encouraged our representatives at the local level to vote against that legislation. At the end of the day, you know, I saw that as a failing of the state legislature and of the bureaucratic process. All too often we talk about bureaucracy, and you have this connotation of glacial pace. And bureaucracy, when it is at its best, is deliberative and it's inclusive. And as a Fitchburg City Council president, I've made that the hallmark of the past 5 years of my presidency of the council, is to ensure that we bring everyone around the table and that we have the discussions, not with different people left out of the conversation or with different areas of expertise. The best product comes when you bring everyone around the table. That's activists with academics and law enforcement professionals and legal experts. And that's how you create and craft good legislation. This bill missed the mark. This is a chance for once-in-a-generation reform, but we have to make sure we do it the right way. because we may never again have the political will to accomplish generational police reform. But that must occur and only can occur when you include everyone around the table. You know, also at the heart of this question, and I believe that it would be lazy of us to just look at generational reform and systemic inequities and say, this conversation starts and stops with police reform. We have to look across the entire spectrum of government and its institutions and ensure that we have an equitable system of government that works for everyone. And I look no further than our local example of when the Black Lives Matter movement and protest came to Fitchburg. It was activists alongside law enforcement and elected officials all coming together and saying that we can, as a community, be a better community, more representative, more equitable. And I have never been more proud of that day in the city of Fitchburg, in which there was not a single arrest made, and it was, in fact, the safest day in the city of Fitchburg in all of 2020 thus far. And to look to my left and see Police Chief Ernie Martineau drop to a knee. And when we were all on our knee and looking at each other and realizing that this is how we heal these divides, is together. And the best product comes when we work together. So I am a no vote because I believe that we can do better as a government and as a legislative body. And I'm anxious to have the opportunity to bring everyone together, as I've done on the Fitchburg City Council, and because Fitchburg has led the way, and I think we can follow that local example.
Thank you, Michael, because frankly, it was probably something that they should have looked at across the country. And it came from a model that we introduced at the Fitchburg Police Department in 2003, when Eugene and Jacqueline Rivers from the 10-Point Coalition in the city of Boston quickly identified that between 4 p.m. and 8:30 p.m., young people were getting into trouble. Gang activity, guns, folks of just 14 and 15 years of age dying on Boston streets. And it was the faith-based community that brought the 10-Point Coalition to the forefront. As you know, Pastor Tom Hughes, great community leader in and of himself, was instrumental in forming our response, not only recently, but over the years, when racial divide or consideration that race was a factor in a police action took place. And it's these kinds of solutions that Glenn Fossa has been involved in. It's these kinds of solutions that came as a result of crisis. It's these kinds of solutions I can bring to the State House.
We good? Is access to health care, including preventative and routine care, a right or a commodity? And by that I am asking whether you support a single-payer system where all residents have equal access to care, or should health care continue to be an insurance product purchased from the private sector? Mr. Kushmerek.
For the time being, I think that we maintain with a insurance system. It's what we have right now, right? But it is clearly falling short of the mark. And out of any reason that has inspired me to run, it's over healthcare affordability and access. For too long, we've been held hostage by organizations like UMass Memorial Health Alliance, which has continued to close systematically the facilities and resources throughout north central Massachusetts, first with Burbank Hospital, later with the mental health unit at Burbank, followed by the urgent care facility at Burbank, the cardiac unit in Leominster. And I question, what is next? Is it the maternity ward at Leominster? Will you soon no longer be able to give birth to a child in north central Massachusetts? Will you have to go to Worcester or Boston to get basic care? And then I look at mental health access. And I look and say that the system is horribly broken when mental health care is a commodity around here. There aren't enough beds to meet the need. People are forced to look outside the region, and we know that disproportionately impacts huge populations. Additionally, if you break your leg, your insurance company will pay for your leg to be fixed. If you need therapy, they'll tell you, we'll cover 15 sessions a year with a daily co-rate of $20 each time you go in. The system's broken when we treat mental health differently from physical health. As a caregiver to 2 elderly parents during the past decade, I've seen what no caregiver should ever see. which is see your mother laying on a hospital bed, suffering, needing care. The care is both unavailable in your region and the insurance company unwilling to pay for it. It took 7 days for a bed to open up and for the insurance company to be forced to pay. And the only reason I was successful in helping my mother, because after 7 days of being powerless and seeing a mother agonizing over needing treatment, I picked up the phone and I called Senator Flanagan and then Representative DiNatale and begged them for help. And they got to work immediately. But it should not take an act of the state legislature in order for your insurance company to cover something that is fundamental to being a human and being alive. Healthcare is a right, it is not a privilege.
We do have an outstanding healthcare system, particularly here in Massachusetts. And of course, anything can always be improved, whether it's police work or fire departments and EMS. But to look at single payer, we only need to look about 200 miles north of us in the great country of Canada. And they've had socialized medicine for quite a long time now, and those of us who may know, frequently Canadian citizens will travel to the US for health care. They stand in long lines, wait months for approvals, and sometimes years for procedures. So maybe a hybrid version of something to improve the delivery of health services here in the state. But I would ask that we look at innovative ways to create competition, create a private-public partnership that can work better for the recipient and the customer. And then just pointing to a methodology on health issues for the community. Some years ago, we had lost our ambulance that was run by the fire department. It was felt that the private ambulance wasn't always available, that there was a priority system, that they were handling other communities, that it was a long wait for a response in a basic life support or an advanced life support response. So we were blessed to be on a task force appointed by the mayor at the time with fire professionals, the police department, and some other city officials, including at the time the city council president. And we were at a stalemate at the table, and it simply was put that we couldn't afford to have the fire department ambulance returned to the city. And they got to me and they said, "You look a little perplexed." I said, "Why don't we lease the ambulance? Why don't we call MedStar or Patriot, see if we can run an enterprise fund, maybe something that can pay for our own ambulance over time." And I'm proud to say that ambulance is running up and down your streets every single day. And I'm proud to say that the Fitchburg Fire Department did take over that plan and did make it an enterprise fund. So I'm not getting off the subject, because if we can do it at the local level, we can do it at the state level. And it's when business and government works together that we get the real solutions. And we can see other communities that have made things happen when true partnership takes place.
I don't argue that we are a true center of innovation in the healthcare industry. We have the best institutions that teach medicine. We have some of the best hospitals in the world. And we have some of the best biotech companies that spawn innovation and entrepreneurship in our Commonwealth. But again, we have missed the mark. When individuals are unable to afford their basic health care needs, preventative or otherwise, when facilities are no longer available and accessible in their community, that is an issue. And so the first bill that I'd like to file when I reach Beacon Hill would be an essential service determination process amendment that would give real teeth and ramifications to organizations that choose, despite the Department of Public Health's recommendation, that a service is essential. So every time that Health Alliance has closed a facility that the Department of Public Health has said, that is essential to your community, there's no teeth. They're allowed to close the facility anyways. And every time that happens, it disproportionately affects our seniors and the poorest in our community, who are then forced to figure out how to transport outside of our region to get access to the care that they need, or simply not to get care at all. That is not an option, and for me, I think, yes, we can pat ourselves on the back. We may be good compared to so many other states across the country, but we're not good enough. We have a lot of room to improve, and we should not be satisfied with the product that we have in this state. And so there's legislation that I believe I can file on day one that can address glaring holes that would help our region and the residents of this region have access for health care and mental health care for a long time to come.
I, too, as a citizen, watched the roadblock of the DPH when we had the hearing, and people made their arguments. They did a good job, and they meant what they intended to do, and they meant for the good of the people. And when government's not listening anymore, sometimes you have to go to Plan B. And you have to come up with innovative and strategic ways to get what it is that you're looking for. And in this case, I think we've played it. I think we've played it out. And to think that we can punish or force UMass Health Alliance to do something that they're obviously unwilling to do, I think we have to meet them at their own 50-yard line and find out how we either get competition to go around them or legislation that increases access.
Spoke to a 23-year-old on the phone yesterday while we're phone banking to residents throughout north central Massachusetts. And this 23-year-old about to vote in an election for the first time asked me about where I stood on issues. And you start with the generic, you start with the general and high level. And he says, how do you feel about health care? And so I started speaking to him about my personal story and my mother's story. And he shared with me that for the past several years, he's been struggling with mental health. And he talked about his story of struggle and of heartache and of talking about how if you break your arm, you wear that cast like a badge of honor and you show it off at work and with your friends. And if you have an issue with mental health, people turn and walk away from you because they think you're crazy. That is fundamentally wrong. And part of the reason there is this stigma attached, we don't have the basic services to address it, and we don't talk about it openly. And so I believe that at a core level, we have to change the way we talk about healthcare and talk about how we include and ensure that mental health is treated the same as physical health. You can't do that unless insurance companies properly pay for it, and you can't treat it if you don't have facilities in your own backyard to help.
Towards the beginning of the debate, Mr. Kuchmarek noted that in the Fair Share Amendment, that only 7 individuals in the state would be affected. And as a testament to that none of the 3 of us on this stage are a member of those 7 people. We flipped a coin for closing statements, and none of us had a coin. So thank you, Nate Glennie, in the control room handling audio for us tonight, to lend us a coin. And based on that coin flip, Mr. Kuchmarek, you have 3 minutes for a closing remark.
First, Kevin, I want to thank you and the entire Flap TV team. Just tremendous job yet again, and I thank you for the service that you do for our community. I want to thank FATV, our host here this evening, and I want to thank my opponent for engaging in these critical discussions. It is all too important to our region that we have occasions like this and that we celebrate occasions like this where opponents come together and talk about critical issues that confront so many lives across north central Massachusetts. And lastly, I want to thank Representative Hay, which is the reason we're here. He has served this city in the state legislature with distinction for the past 5 years and nearly 2 decades of service to this city. We're a better city because of his service. Never in my wildest dreams would I have thought that I would be here today running for state representative. Having served 7 years as a Fitchburg city councilor or 5 years alongside Mayor DiNatale as city council president. We never discussed pursuing those kind of dreams around the dining room table growing up. It was usually about how we'd pay the bills that month. I grew up on welfare and food stamps. And my family struggled with issues around mental health and substance abuse and eventually homelessness. And that seeing my father homeless and on the streets in Chelsea at age 19 and 20 was traumatizing to me. And I realized, and it underscored how far we have to go as a society and how much work we have to do. You know, some will say that, well, this is an example of the American dream, picking yourself up by your bootstraps and succeeding despite the odds. But let's be clear. The idea of bootstrapping is more myth than reality today. that if it weren't for helping hands and some lucky breaks along the way, I wouldn't be where I am today. And whether you succeed or you fail in the 3rd Worcester District or in the Commonwealth of Massachusetts should not come down to who you know, what the income level of your family is, or a couple of lucky breaks. And at the heart of this campaign, that's what I'm fighting for. I'm fighting for you, the residents who go to bed at night after letting out a heavy sigh and wondering, why does life have to be so hard sometimes? I've been there. More recently than I care to admit, asking that same question. And that's what grounds me, that inspires me to run, and I promise to you, the residents, that I will fight for and represent you each and every day on Beacon Hill to ensure that you become the priority of the state legislature and of this government, that we work better for you. So on November 3rd, I ask you to vote for Mike Kushmarek, Democrat for State Representative, and I will serve you each and every day.
Mr. Fossa.
Well, thank you, Kevin. Thanks to FATV, one of my former places of employ, and to my opponent. I want to be clear to everyone that Mike and I spoke on more than one occasion, and we're proud to put Fitchburg first once again. If we have to be the model for the nation, this is how a debate goes. And I appreciate the gentlemanly methodologies forth. This is about people. This campaign is about people, and it's about work that has to get done, and it's about how that work gets done. It's not about government, it's not about how it used to be, and it's not about what would be. It's about new ways of getting things for Fitchburg and getting them done. Every day, hundreds of residents of Massachusetts drive past exit 30, past exit 29, to go to their homes 20 minutes away. 40 minutes a day, 5 times a week, to go to work on the 128 Beltway and places east of us. And Fitchburg's broken. We need to attract those folks back. You need working people with good paying jobs, high paying jobs to feed the coffers so we can pay for these services. The city can't be on the dole for the rest of its life. 3 of the 5 current sitting councilors at large have endorsed me because they know that I am a man of results. They know that I will work tirelessly until that happens. Countless former mayors and former city councilors have worked with me and know sometimes if you have a problem, you call Glenn and we get it fixed. Those are the talents, those are the experiences, and the lifelong commitment to this city that you can bank on today and November 3rd. Early voting soon. Going to get your ballots in just a few days. That's what I want you to consider in this election. It's an election of people, the people that back us up in the campaign. It's the stories they tell. And not everyone is in the same place. There are folks with good paying jobs and 2 jobs and a nice home in Fitchburg, and we're not going to forget them. They need to be represented just as much as anyone else because they actually pay the bills for the city. So I want to thank you, citizens of Fitchburg, those who have come up to me and said, this is a real concern of mine. It is about the potholes. It's about Unitil. It's about a solar incentive that's been hampered recently by our only utility. And it's about public safety, something we can never do without. So thank you. Thank FATV. Thank you, Michael and Kevin. And thank you for your vote on November 3rd.
I want to thank both candidates for respecting each other and respecting the format and the cordiality and respecting the voters by not talking over each other, by expressing your views in a respectful, dignified, and professional manner. And now the decision is up to you, the voters of Fitchburg and Lunenburg Precinct B. November 3rd, go vote. Thank you.